When your elbow pain has become chronic and it's in the area of a tendinous mass, most commonly on the top, less commonly on the inside. The location doesn't matter. It just matters that you know that it's a chronic problem, it's persisting and it hurts. So a couple of ways we can deal with that are yapping and scrubbing. So I'm going to show you those now. When I'm doing yapping, remember it jokingly refers to as yank away pain, yap. When we yap, we're going to grab some tissue in the area of the pain. So let's say I have this lateral elbow pain. I'm going to pull that flesh up and away from the bone. I can move it in any direction, and I'm paying attention to which one hurts the most. Now, I'm not crazy. I'm not trying to create pain. I just understand that if I pull in a direction and it hurts more, that's the most limited direction. So that's the direction I'm most interested in trying to loosen. Because in my daily activities, when I tension that, that's when it'll spike my pain when I'm doing life. So in my treatment, if I can find the direction that hurts the most, that's the one I'm going to loosen and have the biggest difference in my day-to-day life. So what's a nice way to do this is do an activity that hurts, whether it's squeezing, lifting something, whatever it might be, and then do your yapping and then retest. If you're barking up the right tree, you'll have some amount of improvement, maybe not a ton, but at least some, even after just one session. So let's review. We're going to grab something, and it might be a little further away. It might be a little further away, higher up the chain or lower, but you grab it in the neighborhood of where your pain is, pull it in any direction you want, feeling for which one hurts the most, and then superimpose some movement. So it might be wrist or finger or both. I might move the elbow itself. I know for me, when I've had this problem in the past, I call it a door knocker. So I make my fist like that, and then I keep that, and I stretch all that tissue, a door knocker stretch. That really got me, and then I just move where my fingers are, and I just keep going, and if I go like right there, I feel a whole lot of nothing. I'm not going to waste my time. I want to go where I feel something, and it hurts, but it hurts in a way that's acceptable to me, and it might hurt a lot, and if you're okay with it, do it. You're causing no harm. It's just not pleasant. But 30 seconds to a minute of that, shake it off, and retest your thing, whether it's gripping or lifting or whatever. You should go, wow, that seems a little bit better. And then you just chip away at that in an amount of time tolerable to you. It doesn't have to be a minute, doesn't have to be 30 seconds, it doesn't have to be anything. Maybe it's 10 seconds, and oh my goodness, that's all I can do. And then when you're ready, do another 10 seconds off and on throughout your day. It will do much better little bits and pieces throughout your day than once for one long time, okay? Now, that's yapping. Now we're going to talk about scrubbing. With scrubbing, you're going to use a lacrosse ball, or this is a rad round, which is almost the same thing. And I'm going to be in the area of the pain. And again, it might be a little lower, it might be a little higher, but I'm going to use the grippiness of the ball as a tool for me. So I'm just going to put downward pressure, and I'm going to use that downward pressure as a way to manipulate the tissue, just like I did when I was yapping. And then just like I did when I was yapping, I can tension it in any direction, and then superimpose wrist or finger or forearm or elbow or combinations of all the above while I've got it tensioned. Anything that feels like it kind of hurts good is a good spot. Now, to fine tune this, what you can do when you scrub is put that downward pressure on. With a little downward pressure, I'm then going to twist it. Now, clockwise or counterclockwise, that's entirely up to you based on symptoms. And then when you twist it, you just sort of take more slack out, if you will, and then you go to scrub it. And it will feel different. So downward pressure, little turn, and off I go. Downward pressure, little turn, and off I go. If you don't want to pay that close of attention, just do some of them one way, some of them the other. But the idea is that you're using this tool and this tool as a means to free up the connective tissue layer under your skin above the muscle called fascia. That's where scar tissue fibers tend to reside, where restrictions tend to be, and when you in daily life create muscle tension, either by contracting something or moving in such a way that that pulls on it and elicits your pain, then your answer to that is kind of pull out that tension, and that's what yapping is and what scrubbing is, at least intended to do as best we can tell. But it works, and it usually works fairly quickly, so give those a try.